All right, hi everybody, welcome. We're going to go ahead and get started. Today I have the absolute pleasure of welcoming Dr. Monica Peak to our lecture series. Dr. Peak is the Ellen H. Block Professor of Health Justice in the Department of Medicine at the University of Chicago. She's an internist, medical ethicist, and health services researcher. Dr. Peak's research focuses on structural and social inequities that impact healthcare delivery and health outcomes among marginalized patient populations. Okay. She is an associate director of the MacLean Center for Clinical Medical Ethics and an associate director of the Chicago Center for Diabetes Translation Research. Dr. Peak has served as the principal investigator for grants from institutions such as the Greenwall Foundation, NIH, CORI, AHRQ, and the Robert Wood Johnson Foundation, among others. She's also a member of the National Academy of Medicine and a really big deal. Let us give a warm welcome to Dr. Peak.
Thank you. Just for the record, she's a really big deal. It's not part of my bio. Megan added that. Thank you, Megan. Can people hear me okay? I'm gonna maybe move this up just a little bit. I am thrilled to be here to talk about academic medicine and activism. When I first heard that we were going to have this as our theme for the year, I was like, sign me up to go first. And I am really excited that that didn't happen because had I been first, I would have missed the whole election, our rise of fascism, and my ability to talk to where we are right now. So I'm excited. I've been giving a few talks about these issues. The talk that I would have given in the fall would have been a completely different talk. And so let's go. I will say that my tech support, who normally is in the back, I told him to sit right here. And I said, actually, I would have preferred that he stand right here next to me the whole time, because that's how limited my skills are. So that's my disclaimer. All righty. The other thing is that for those of you who don't know me, what I do every day is try and fight for social justice. And so I'm going to be talking about activism in the lens of health equity. But that takes place in a broader context today of our democracy. And that narrative will be woven through what I'm talking about. And I'm happy to have a broader discussion, if there's time, about those very institutions of which academics is a core institution of a functioning democracy. So one of my favorite writers is James Baldwin. And so he's going to be with us today. The first quote that we'll hear from him is that we can disagree and still love each other unless your disagreement is rooted in my oppression and a denial of my humanity and right to exist. Those are the ground rules of our discussion for today. So our agenda, I'm going to talk about what is happening now, the implications for health equity, normative frameworks for social justice and equity, what I'm calling truth decay and misinformation, the role of doctors, and then some final thoughts. Y'all ready? What's happening now? We're in the process of transitioning from a liberal democracy to an authoritarian state. The first time I said this more than a year ago, people were like, are you sure? Now everyone's like, yeah, I'm pretty sure. What has happened is that what used to be more fashionable as far as an active coup, the use of force or violence to seize power, we tried that actually in this country and it failed, has been more stylish and trendy to have a self-coup. where we actually elect a president who then starts to attack our Constitution. And that process of having a president or an elected official that we elect who then slowly collects power over time, we call it executive aggrandizement. And it's usually more of a gradual process. It uses existing legal institutions, courts, legislative bodies, to distress the axes of democracy. So there's a loss of checks and balances, a loss of executive accountability, a subversion of free and fair elections. And so we saw right before this election, there was a rash of laws that were being put in around the country to suppress voter rights, that made it illegal to bring an elderly person a glass of water, a place to sit, while she was trying to stand in these, super long lines because they had closed down many of the polls and places. So we knew that the, people who were disabled or older or lived in very rural areas were going to have to work extra hard to vote. And it was illegal to provide them any support while they stood in those super long lines, things like that. And this process accelerates once voting power is too weakened or divided. We are currently in that accelerated process where, every day it's like, what is happening? We can't keep up. So that slower process before the election, we're like, something doesn't quite feel right. Now we're like, what is, this is where we are now. So we're not alone. This process didn't just happen, with this election, as far as the number of countries globally that have been moving towards an authoritarian state and moving away from democracy. If we can think about this like an infectious disease that travels the world, people are social creatures. We talk to each other. Our leaders talk to each other. Ideas spread. That's the potency of ideas and words. And so, we see that with our leaders. And so, the idea of a democracy is something that is on the decline. Our United States has been a flawed democracy for some time. And I was actually listening to NPR last night, and they were talking about how just some of the ratings with a different system than this, but how we had taken such a big hit in 2017, and just how the events of the past few months have. So right now, well, this is aside from this, but based on what I was listening to last night, our democracy is currently at the level of Argentina, Panama, and another country, they said. So this is from 2022, and it is put out by the people who have the magazine called The Economist, and they sort of keep track of democracies in the world. And they have 60 indicators of democratic rights and institutions, focusing on civil liberties, political culture, pluralism. And so at least in 2022, we have been a flawed democracy and just sort of slowly sliding downhill, really starting in 2017, but even before that. And so this is the map from 2023 that shows the United States, where we are comparable to South Africa, to India, some parts of South America. There's our friend again. Neither love nor terror, I think we're all experiencing some terror right now, makes one blind. It's indifference that makes one blind. So what I think a lot of us, the thing that I like to think about a lot is that courage is not the absence of terror or fear. It is doing things. It is action despite those feelings, right? Part of what the current plan is to make everyone feel so terrorized that they are frozen in place, that they are too afraid to act because of retribution. It is the action in spite of that terror. It's the people that we're starting to now see resist and stand up that is going to keep our democracy in place. So what are the implications of what's happening now for health equity? Part of the definition of a democracy is the idea of pluralism. What does pluralism mean? It means that we have decided that no matter who you are, what your sexual orientation is, what your gender identity is, your race, your ethnicity, your immigration status, how you love, who you believe in, what your religion is, that we can all live safely in the same space, respect one another, and come together as a nation of immigrants. That is historically who we have been, a nation of immigrants, and live in this experiment of democracy. We are one of the youngest countries in the world, but we are the oldest democracy. We are one of the youngest countries in the world, but we are still the oldest democracy. We have decided that pluralism is something that we have embraced all of this time. Countries from around the world have fled persecution coming here to our safe borders. When we no longer hold those values dear, we become a place where people are fleeing here to other countries because of that. We're starting to see that now. We're encouraging that as a country, that people self-report. We're threatening that if I don't like you, even if you're a US citizen, I'm going to put you in someone else's jail. Is that American? Is that who we believe ourselves to be as part of a pluralistic democracy? That is not part of who we're supposed to be. So there are a lot of there are a lot of implications for our country, for our democracy, but also specifically for health equity. We know that countries that are less democratic have increased violations of human rights, and those human rights violations are disproportionately borne by marginalized populations. And if you're listening to the news, you'll see that the things that are considered, waste and fraud, the things that we're closing have to do with, departments that are monitoring, civil rights, departments that are looking at human rights, departments obviously about diversity, equity, and inclusion, women, the loss of reproductive rights, obviously racialized minorities. We see things like voter suppression, affirmative action, anti-DEI legislation, sexual orientation and gender rights, big focus on transgender rights, and healthcare. This is why I'm talking about it, not just as a public citizen, but as a clinician. Many of these rights showing up where we work, where a lot of these rights are being rolled back. And the socio-political and the physical sites of attack are going to be showing up more and more in our places of where we work. And so we've already seen these things around abortion care, equal protection, the physician pipeline, huge, not just bans of these things, but threats of our academic institutions and threats of other places that if you continue to work on these activities, we're going to pull your federal funds. Hence the existential terror. The person who wrote the chapter on DEI in Project 2025 said the point of that is to force the academic institutions to have existential terror and to make very difficult choices. And this is exactly where we are right now. Terror, again, is not terror, it is indifference. You cannot let terror hold us hostage. So what do we sort of think, what do we have in our ethical back pocket to sort of be thinking about some of these things? And these, I could talk for 4 hours. I'm trying to condense all this down into just a little bit. So I always go back to my favorite dude, John Rawls, who would be horrified by what's happening right now. A prominent political philosopher who talked about the establishment of equal liberties, equal opportunities, and the fair distribution of resources and support to create this fair equality of opportunity. Everyone should have the equal opportunity to pursue life, liberty, and happiness, right? That's what America is about. Life, liberty, and happiness. We should all have those fair opportunities to pursue that. And that there shouldn't be any barriers to pursue that. There shouldn't be barriers to access that. It's particularly ones that are discriminatory. And if there are, then we, as a society, should have anti-discriminatory measures, positive social measures put in place to balance that out, to balance that seesaw out. Particularly things that that are related to the underdevelopment of skills due to unfair social policy. As an example, the legacy of racial bias, thinking as things that we might do, the provision of public education is supposed to be sort of a balancer. And so we get to the idea of this distributive justice that a lot of people know about and sort of think about in health. So Norman Daniels. So he applied this idea of Rawlsian justice specifically to health and healthcare. And so the idea that protection of normal functioning is another sort of primary social good. So the idea of the equality of opportunity to pursue these things, these broad sort of social goods around life, liberty, opportunity, income, wealth. Another primary social good is the protection of your normal bodily function. You have the right to the good of having a healthy body. And that disease and disability shouldn't impact your range of opportunity. And we know that diseases are disproportionately borne by marginalized populations. And why is that? Because the unequal or inequitable distribution of societal resources. We talk a lot about the social drivers of health. And what we're talking about is poverty, exposure to toxins, food insecurity, all of those things. Who is exposed to those negative social drivers? Who is exposed to the positive social drivers? All the green space, the clean air, the water without lead. If we look at those two groups, one group has all of the social capital, the other has none. It's not a coincidence. It's not a coin toss. And so our society makes choices about the haves and the have-nots. And so because of that, who is disproportionately getting diseases in our country should not be a mystery. And it never is, right? You can look at the poor and downtrodden and say they're the ones who are going to have all the disease, and voila, that is exactly what happens. And so we should understand that disparities in health outcomes, as well as healthcare delivery, are inherently unjust. And so the provision, the active social measure to address that is a moral imperative. It's an ethical imperative, at the very least of which should be the provision of healthcare and health insurance. And there are people, myself among them, are arguing that the provision of social care should also be something that we provide as we're thinking about the integration of medical and social care as part of comprehensive healthcare services. Okay, so this is my technical limitations because this, okay, no, I meant to put that here. So that slide was helping us think about health equity. So I'm going to talk a bit about that. I come back here to remind myself, to put a pin in this conversation about this whole bit around fair equality of opportunity, and how everyone should have access to information, and the provision of public education, and have skills that are fully developed. And what we're seeing right now is an attempt to close that down, right? We're seeing an attack on public media, of educational institutions, of a lot of things to try and narrow informational access, right? And so that is a political thing, but it is also harming everyone's ability to live their best life, right? That's part of an authoritarian government. And so this is also part of what it means to not be in a democratic country. And so as we're in this time and space, we should be thinking about health equity. We should be thinking about information and misinformation, those 800 cases of measles in Texas right now. We should also be thinking about the implications more broadly for our democracy. Truth, decay, and misinformation. This has implications for us as clinicians, as we treat our patients, as we're thinking about truth and science, and as citizens in this country. So truth decay is something that when I first heard it, I was like, that is exactly, years ago when Trump started making his first appearance, like, that's what's happening. Blurring of truth and opinion. This valuation of personal anecdote over fact, how some people call themselves a news program when they're really just like, I don't know what you'd really call them. It diminishes societal trust in news in general when people are delivering information that is not fact-based or not newsworthy. And so it does all of us an injustice. And so people start turning to other sources of information rather than our trusted media, because it sort of puts us all sort of in a bad light. What do we do about that? And so this morning, my days are so long and crazy. I think it was this morning. It was this morning when they were talking about those 800 measles cases, and they had done an interview of a lot of the people. And then, of course, they were saying, you can imagine who was more likely to have misinformation that they believed about measles, and vitamin A protected you against it, et cetera, and that they were going to not vaccinate their kids, et cetera. And so, what to do about this? These are very real problems. We used to not really have measles in this country. Texas is a hotbed of measles. Measles is so infectious. In a blink of an eye, we're all going to have it. What can we do? Who's at risk? People who have a distrust of traditional sources of evidence, fake news, people who may primarily be using social networks for information, people who have low literacy and low health literacy, people who are influenced by groups with secondary gain from misinformation, political groups, marketing, social media influencers, people who don't have enough skills to discern between information and misinformation. So you have a group of people who don't have a lot of necessarily the skills to tell the difference, who are being preyed upon by people who know better, but have political gain. We saw a lot of this with the COVID pandemic. People who swore on their deathbed that they did not have COVID and died from COVID anyway. We're going to see a lot more of this. We also see people whose distrust in public health and the medical system has been rooted in unethical medical and public health experimentation. These are my people who have been exposed to structural inequities in government, institution, and policies, the police and criminal justice system, the public educational system, child welfare and housing, all of these systems that have failed us miserably. So when we come knocking saying, hey, Black people, we got something good for you, we're like, do you really have something good for me? The top one that says how Black slaves were routinely sold as specimens, live people, not dead people. How Black people in their full humanity were routinely sold as specimens to ambitious white doctors. This goes way back. And slavery was not that long ago. Not that long ago. I went to visit my grandmother's. Know thyself. I should always have tissue. I always forget. At some point, I'm going to cry. I think it may be right now. I went to visit my grandmother's funeral, her gravesite a couple of years ago. And there was somebody there who died in 1950, but was born during slavery. Slavery was not that long ago. It seems like, wow, Black people always talk about that. It's not that long ago. I never really thought about why white people didn't trust the government so much. I'm like, I never really got that until I understood how, with the Civil War, how the federal government, in trying to reunite the country, was seen as a government that was infringing on state sovereignty, and how the people who were in the South had very little money. And the federal government was like, I'll just take that, thank you. And there was so much resentment around that still exists today. And so there's a lot of governmental mistrust and distrust from a lot of different people. And that trust is not just compartmentalized with one institution. You know, it goes from one government institution to another. And so we have to really think about how we engage in those communities who are distrustful, and how that distrust can be manipulated by bad actors with malintent. So this was one of our former Surgeon Generals who put out a report called Confronting Health Misinformation. What can we do? What health professionals and health organizations can do. Things that just make good sense, but we have to actually do them. Proactively engage with patients and the public on health information. You may have seen and heard a lot of doctors who are standing up and saying, yes, this is information. RFK Jr., he may be the head of HHS, but he has no idea what he's talking about. He has no clinical credentials, and there is no association, there's no science that shows that vitamin A can prevent measles. The only thing that prevents measles is a vaccine. Please get that. We have to stand up as health professionals and speak truth in spaces and places that we may not otherwise be comfortable with. Using technology and media platforms to share accurate health information with the public, partnering with community groups and other local organizations to prevent and address health misinformation. We have to go to where people are and be in spaces and places where people are getting that information. We can't just expect that people are going to go online. And now that the online spaces are a lot of times being hijacked. So we have to be our respected selves in places that we may not have otherwise been. This is our dean of our medical school. She wrote this in 2020 about addressing medical misinformation. The bottom ones around conflicting interpretations of science and inappropriately applied science, that really is kind of stuff for us. The things around pseudoscience, junk science, that's what we're really talking about. The things that we need to be addressing more aggressively. The misinformation due to unscientific claims, claims made on fraudulent or disproven data. So fear of vaccines causing autism, the Goop website recommending jade eggs, and then what people have done to try have people like us in this room to address misinformation. And so during the pandemic, I'm just going to try and check for myself. So during the pandemic, I did a lot of thinking around COVID, because there were a lot of people in this community who were a little concerned about our pandemic, and we were trying to get everybody in this hospital, many of whom lived in the surrounding community. We were trying to get everybody in this community vaccinated. And as a bioethicist and as a Greenwald alumni, I was talking to various bioethical scholars about how we engage with people who have social political distrust, thinking about COVID as a case study. What we knew from the literature is that clinicians were a source of trusted information, and that we might be able to mitigate some of the COVID distrust. And so some of the strategies, the 4 strategies that we came up with were, here's the paper that we wrote. Lead with listening. We knew that patients wanted to be heard and validated. Consider starting a conversation with an open-ended question. These are things that are going to be relevant right now. Tell me what you think about the measles vaccine. Tailor your responses to patient concerns in a non-judgmental way that feels collaborative, using motivational interviewing techniques. They can also address concerns that may be rooted in injustice. And so here's some examples of some tables that we had at the time where we were having a lot of pop-up sites around COVID, because no one had ever had a COVID vaccine. We're trying to get the whole country vaccinated. There are all these pop-up sites. There were police officers that were put there to make sure that people weren't storming the places and stealing the vaccines. But for undocumented citizens, Were the police officers there collaborating with ICE? Well, so there's so many things that you have to think about as far as unintended consequences that at that time was just in theory. In today's time, those would be real concerns. And so, how do we think about how do we think about real and potential, possibly just potential concerns that people may have? So we have to think about, as clinicians, how we're addressing all the misinformation in order to think about all of our patients, particularly those who are disproportionately marginalized, who have less access to information, who have not had the same quality education, and so probably have lower literacy levels and lower health literacy and health numeracy. The role of doctors as researchers, it is our job to create new information, new knowledge, and to stand the ground of the knowledge that we have. We are currently under an administration that is actively trying to roll back what we know to be true, that is trying to gaslight the information that we know to be true and trying to change the narrative on new knowledge. We cannot stand for that. We cannot let it stand. And it is our job to fight for that, to not cede that territory. For so many reasons. One of them, when it comes to health equity, is that when it comes to racial and ethnic minority populations, there's this strong association between this group of people and worse outcomes, worse health outcomes, worse educational outcomes, worse outcomes, you name the outcome, it's going to be worse. And so the question is it those people? Or is it the circumstances in which we've been forcing them to live, work, and play? The question seems obvious. The answer seems obvious. It's taken us decades, if not hundreds of years, to sort of come to the conclusion that it's the circumstances. But the reason it's been so difficult is because the narrative around race, the biological essentialism, is it the shape of their head? Is it the bridge of their nose? What is it about these people that makes them biologically different? That narrative has allowed us as a country to subjugate entire races of people, to make it okay to enslave them, to try and wipe them off the face of the earth as far as the American Indians, to do unspeakable things to entire groups of people because they are inferior. They're not even really human. And so the narrative that it's the people, not what we're doing to those people, that makes them worse off, has allowed us to be confused as to the cause of why people are worse off. If we do not stand that ground about what the way in which that arrow is going, and not just say that health disparities exist, but they exist for these reasons, and we know why, and we have been documenting the reasons why, and we have just gotten where we are now, that creates a vacuum for that old narrative to come back. And they are actively trying to reintroduce that old narrative. The anti-woke, the idea that this is we're going to be anti-equity because we're interested in a merit, trying to link the idea that if you have Black or brown skin, that you are inherently unqualified, already in just 3 months. DEI is a word that you're not even supposed to say. Equity is something that's bad. How is equity something that is bad? So we are in a process of trying to rapidly turn back all of the gains that we have painstakingly made over decades. And there are repercussions, there are implications for that. So this unequal treatment report came out 20 years after the first one. In book form, it landed on my desk a few months ago. It was sponsored by NIH, AHRQ, which, is getting dissolved, if not already, as we speak. These are my co-authors, my committee members who worked tirelessly for 2 years to get this report out. And what we ultimately said is that we want to create an equitable healthcare system to create better health outcomes. But in order to do so, we have to recognize all of these things over here. That is the unequal circumstances in which people are living that predates what's happening in the healthcare system, that predates the health outcomes that we're seeing. That none of this business about brown or black skin is what we're talking about. It's people's reactions to that brown or black skin and how they are forcing people into, grant housing, how the, racism is, having people shot like dogs in the street. The stress of wondering if my black son will make it home safely is increasing my cortisol and changing my resting heart rate. All of those things is changing people's pathophysiology, is changing our epigenetics, and it is not just changing us. It is changing our children genetically and their children. Even if I move to Mars, the imprint goes at least 2 generations out. That narrative is what we now know to be true. We cannot allow decades of research to be completely wiped away by one ignorant man and his desire to re-oppress entire populations of people under the guise of anti-DEI. What we have seen is an implementation of a range of policies that have put people's health at risk. We have seen the Cancer Alley, where there is litigation where so many Black and brown people were getting sick from all kinds of cancers because of the poison from the chemical industries. All that litigation eliminated. Every police brutality case that was in the courts released. So many instances of things, environmental justice for all the toxins that have been disproportionately affecting communities of color. And there have been sort of actions to try and, work on that, to try and get, some equity around this, some green space, some clean air, some water that's not contaminated, all that gone. These are active ways to re-kill, to actively undermine the health, well-being of brown and Black people. So then we'll see those disparities rise, but we don't have the right narrative. We're going to once again blame those people. We cannot let that stand. So we have to be educators, even if that's not our job. Even if we didn't think that we were supposed to be educators, that is everyone's job. This is a paper that came out before Trump got reelected about doubling down on diversity, and people have been doing a lot of things, not only talking about misinformation to your patients, we have to talk about what I was just talking about to everybody that we know. This is a podcast series. The first one, episode 1, Racism, Police Violence, and Health, that was started a few years ago. And you're thinking, oh my God, that can't still be going on. Episode 26 aired 3 weeks ago, right? There are those of us who are still in this fight. I ask you to stand with us. Cultivating anti-racism allies in academic medicine. We wrote that paper, Monica Vela, a former cardiology fellow, a former resident who went on to a GI fellowship, not knowing how much we would need our allies. We need you more now than ever. So my final thoughts, we are starting to see some active resistance And that is what it's going to take. For anyone who has read about authoritarianism or is listening to all the political scientists now, they are absolutely convinced that that is what is happening right now. And that the way to fight that is not through anticipatory obedience, but through active action to collectively stand up and say no. Not everything that is faced can be changed, but nothing can be changed until it is faced. So some of you may or may not have seen this that came out on February 20th is one of our first papers starting to make commentary about the administration and what we should be doing. This was from the editor-in-chief and other editors from JAMA. And so they were affirming many principles that they hold dear about science and medicine. First, we reaffirm the principles and values found on our mastheads that have held us in good stead for decades. It is our mission to advance the science and art of medicine and the betterment of the public health, and includes specific objectives to maintain the highest standards of editorial integrity and quality, independent of any special interests, et cetera, et cetera. Some of you may have seen this one from Stephen Wolfe. How should healthcare and public health respond to the new administration? This was something I highly recommend people look at. He said a number of things are clear, including the science is clear that racial and ethnic health disparities are real, that they cost lives, and that they are perpetrated by structures and institutions in society that systemically disadvantage racial and ethnic minoritized populations. Elections and culture wars do not change that reality. Policies that deny the very real existence of racial and ethnic disparities, prohibit the mention of racism by name, or ban efforts by the government, healthcare, and the private sector to reduce disparities will predictably increase the morbidity and mortality and should be opposed by the profession. I'm part of the National Academy of Medicine, and nearly 2,000 of us, 1,900 of us, wrote an open letter on March 31st that was published in Scientific American and the New York Times, talking about the wholesale assault on US science from the Trump administration. And it was organized by Stephen Wolfe, this guy, and sort of a band of mighty warriors of his. And this was a letter that was not officially sanctioned by the National Academy. So we didn't have access to the database. It was word of mouth, person to person, sign this letter and spread it to 10 of your friends. And in 2 weeks, we had almost 2,000 people. And so then he sent an email to everyone who signed off like 3 days later and said that it already had almost 3,000 views, that the Washington Post, the Guardian, Scientific American, and Stat News had covered the story along with the Wall Street Journal. Coverage also included CNN, PBS, ABC News, NPR. It was covered overseas in Brazil, Canada, Germany, and Japan. Stories were in development in France, Italy, and Spain. The open letter had been disseminated by Public Citizen, LinkedIn, and other bloggers. We'd gotten supportive messages from scientists, engineers, and doctors from around the world, and that many other people had been supportive. When Harvard stood up against the government, everyone around the world was like, yes. At least I was, right? Everyone has to take a stand. We're all full of terror, but we all have to be courageous. And we have to stand together. I'm going to leave us with a few things. Has anyone seen on Apple TV is like killing it. I've been like addicted to simultaneous shows right now, so I keep my resting heart rate down. Because really, in reality, it's 110 to 115 since November. Did anyone watch Chernobyl? All right. Tell me what it's about in a nutshell. And so just go ahead and give the spoiler alert. Um, so what's the message for us today? How is it relevant to us today? Y'all had lots of time to watch this already, so.
I did his advocacy to exposed to toxic radiation, he ended up dying of premature death, finding out of his advancing illness and his choice to end life. But I think the kind of central message is that his advocacy is worth more to him than those costs, and has these incredible effects in terms of giving the whole issue on the exposure, general opposition to the
So Chernobyl was a big explosion at a nuclear power plant. And it was an explosion that happened at the time, people couldn't figure out what went wrong. Turns out a scientist had predicted that this was going to happen. But because they were living in an authoritarian regime, they did not want to admit that they were not perfect. And they didn't want to pay for the cost of fixing all those nuclear power plants. And they were like, you know what? The chances of this aligning of the stars so this explosion would happen are really small. We're going to roll the dice and say, let's say it'll never happen. We're going to make this scientific paper classified and just tuck that away someplace and just cross our fingers. Well, guess what? Eventually that event happened. People died. And what was portrayed as one female scientist was really a team of scientists who were trying to figure out what happened. They put their lives on the line, trying to uncover that story. And eventually went to court, told the truth, and had to go to the UN and speak the truth in front of the world in order for Russia to acknowledge what really had happened, because they were trying to say that that hadn't happened. They had to acknowledge it to the world in order for those nuclear power plants to be changed in Russia, and for anyone else in the world who had the power plants to be able to make those changes. So they stood up for the rest of us, right? Because if they hadn't, invariably that other accident would have happened again. In addition, that horrible explosion was not just a one-time thing. It was causing slow melting underground. And it was going to require people to go underground and fix, I forget all the details, but fix it. Otherwise, another explosion might happen where stuff would enter the atmosphere and possibly kill everybody in the world. Who wants to go to an active nuclear radioactive site and fix that? Any volunteers? Nobody? Nobody? People volunteered. It was the people who were coal miners, who were used to going underground and who knew how to do that. And they said, I know I'm not going to live. I'm not even going to wear this little mask that you're giving me, because clearly that's not working. They gave up their lives. They survived long enough to get the job done. But they did that to save all of us, right? Under authoritarian regimes, truth does not necessarily matter. Power is more important. What we have to do is be willing to stand up for the scientific truth and for what is the right thing for the rest of the people. the right thing for humanity. And we will be tested. We're being tested right now. Right now. How are we going to respond to the terror that we are experiencing? And who are we willing to risk our safety for? For people who we don't even know. I'm going to leave us with an example that is not in Russia, but is here home. Some Chicagoans. Ida B. Wells, who originated from Tennessee, which is where I'm from. She was a Black woman who went around during the time of lynching. And you can imagine how horrible that was. Who was being lynched in the South? People who looked like her. So dangerous. Those lynchings were social events for white people. So to be a Black person, first of all, they saw you, and to report on them, her life was always in danger. Because that was a secret, that was like a little party. People would take pieces of the person and send them around and send postcards, but they didn't want the rest of the world to know about it because they knew it was like not really the right thing to do. So that's what she did. She reported on lynching. She had to move to Chicago because it was unsafe for her to stay in the South, but she did that for the rest of her life. We have places here in Chicago that are named after her. So for her to look at ugly things, shine light in ugly spaces, and speak truth to power is what we have to do. Muhammad Ali, whose house is, was right here in Hyde Park, who was not the biggest man or the strongest man, but he believed he could do great things. And he did. He did. That is what we have to believe in ourselves. We may not have the most power right now, but we have to believe in the power that we have in order to be able to do great things. And then finally, Obama. Look how youthful he looked. He asked us to have the audacity of hope. And as a scientist, I know that for people who are want to do a behavior, I'm always thinking about chronic disease and behavior change. The most proximal thing, the last thing you have to do before you actually engage in that behavior is have confidence, self-efficacy, to believe in yourself. You have to have the hope and the belief that you can do it. So we have to have the strength to look at ugly things. We have to have the belief that our power, though it may not be great, is going to be good enough. And we have to have the hope in ourselves and each other that we'll be successful. With that, I would be thanks.